right, great. We're here in Las Vegas, sunny Las Vegas, this afternoon with my good friend Ivan Wayne from Oklahoma City, and kind of wrapping up the meeting. Ivan, I've had a pretty good time this time. Yourself? What do you think?
It's been really productive.
Yeah?
Really
Okay.
well-organized meeting. There's always new things, no matter how much you think you know.
Yeah.
Somebody's got a better solution. Somebody's thought about it better than you have.
Did you get a good takeaway from this meeting? You know, I've always thought if you can get, especially at our point in our careers, if you can get that one takeaway, that's a useful meeting to go home with.
Absolutely. So my takeaway, I've been doing facelift for 17 years.
Yep.
And I've really thought little about the buccal fat pad.
Yeah.
But I've heard more about the buccal fat pad in 3 days than I've heard in my entire career.
Yep.
And it's just like, there's another thing I never appreciated, and I think that's the value of these meetings. It's really awesome.
Yeah, yeah.
And
Isn't it funny how things seem to run in cycles?
Yeah.
Because you're right, this was kind of the buccal fat pad meeting. It was the brow meeting too. That was actually my big takeaway. The concept that we're likely over-fixating brows. Did you see the talk where the long-term follow-up deal where, fixated or not, medial brows continue to elevate over the course of about 10 years? If you simply release them. So, all these folks, we're all worried about having over-elevated brows, and all these folks that you see after the first couple of months, and they're kind of like, I don't really see any difference. Follow them out over years, it looks like those are actually continuing to rise. So I'm more convinced than ever that I'm doing the right thing, not fixating those brows and being pretty conservative on that.
I agree with the brow. I think brows might be the trickiest, that there's that thin blue line of corrected, and then you're over-corrected and it looks weird and done. And it's so hard to get it. Rarely anymore do I address a medial brow. It's got to be a truly patient with the pathology and the motivation and the understanding that this is different. And but it's absolutely very interesting about the brow complex. And I think some of the talks I saw on filling the brow made me think a little differently about what we're doing with the aging brow. Is probably more deflational than descent. And they're getting some really good results. So I'm going to bring those into my practice for sure.
I think clearly that that is the case. So speaking of injectables, are you doing anything differently or more frequently with fat transfer and volume enhancement, all of that?
Well, I've been doing fat for a long time, and I love it, and it's great. I didn't pick up anything special about fat, but I did pick up a lot of nuances on fillers.
Okay.
And there's a lot of things I haven't been treating probably as well as I could with volume enhancement with fillers. And a lot of the cheek work that I saw was more of a subcutaneous rather than a deep fill, and the results clearly are better, and maybe I'm thinking about that differently.
Well, I think as we get more and more products on the market too, it gives you a great, just different kinds of flexibility in what you can do with your fillers and where you can place them, so that's kind of cool.
Absolutely.
Yeah. Another great thing about this meeting is the social aspect. For me, it's always awesome to get together with my friends and good long-time colleagues like Dr. Wayne. What's the most fun you've had since you've been here?
It's been Vegas is it's an interesting experience. So I've been pretty good. We did hit the craps table last night a little too late.
Did you do any well? Do any good?
But it was still fun. That's the thing. Whether you win or lose, it's a fun experience. And we had, craps. You're up, you're down, you're up, you're down. Then you got nothing left.
The energy's always there.
The energy's there. That's always a good time. Really, the social aspect of this meeting is great because I walking around, it's like, oh yeah, I haven't talked to you in a year. It's great to catch up, and really people have made great connections with through this awesome our various associations and academies and all that.
Yep.
What about you? What's the most fun you've had?
Wow. Probably.
Assuming it's something that you leave Las Vegas.
Yeah. A lot of stuff does need to stay here. I think my takeaway, my social takeaway, is a new drink discovery from next door at the Cosmetology.
Okay.
A Verbena.
Verbena.
Yes. Yeah. You should try this. We've done 2 nights in a row. It has a little flower that floats in it. The drink itself is kind of like a pisco sour or something.
Okay.
But the flower you do pre-drink, you chew it up, and it's got to be some kind of a partial neurotoxin. I think it's kind of like what tetrodotoxin feels like when you're eating puffer fish.
Okay.
So your mouth numbs out, and then you do the drink over the course of time, and it kind of all changes as the neurons wake up.
That sounds fun. We'll be at the Cosmopolitan tonight, so we'll look that one up.
Fabulous, fabulous. Well, great getting to spend time with you as always.
Always.
Talk a little bit about cars and racing. And a very little bit about plastic surgery.
We almost had no surgery. We've been talking about no medicine here. This is what we need.
It's a good thing.
Good deal. Pleasure to see you as always.
Yep.